I would like to begin by acknowledging the traditional custodians of the land on which we meet today and pay my respects to their elders past and present.
Hello and a very warm welcome to the 2021 Medical Careers Virtual Expo. This event is jointly brought to you by the Australian Medical Association of Western Australia and the Postgraduate Medical Council of Western Australia.
I would like to begin by acknowledging the traditional custodians of the land on which we meet today and pay my respects to their elders past, present and emerging.
My name is Gemma and this is Meg, and we are your 2021 AMA Doctors in Training co-chairs. We're really excited to be able to launch our first virtual expo. We have had over 600 medical students and junior doctors registered for this event, and we hope that this format provides an innovative and interactive experience for everyone.
The Australian Medical Association and the Postgraduate Medical Council of Western Australia would like to acknowledge the following sponsors for this evening. Our platinum sponsor, St John of God Healthcare; gold, the Western Australian General Practice Education and Training Network; and silver, Joondalup Health Campus. On behalf of medical students and junior doctors, we thank you for your continued support.
We hope you enjoyed the range of interviews and questions last night, and we welcome you back for another evening to learn more about the various specialties available to you. This evening will entail panel discussions that will be facilitated by junior doctors you are likely to be familiar with.
The junior doctors will ask the panels of college representatives a number of questions, including some suggested from you at home. Questions are welcome at any time and can be asked by clicking on the Q&A icon on your screen. We hope this approach results in a fun, interactive and insightful evening into colleges and the training programs that you're interested in.
Recordings of the panel discussions will be hosted on the event platform you're watching through until late May. Following this, the Postgraduate Medical Council of Western Australia will be using the recordings to create a careers portal for you all to access throughout the year.
Routine information such as training position numbers, application dates and accredited specialty training hospitals will be available on the event portal under the Documents tab, and then on the Postgraduate Medical Council of Western Australia website. The busy lineup of colleges this evening includes the Royal Australian College of Surgeons, the Royal Australian College of Obstetricians and Gynaecologists, and the Royal Australian New Zealand College of Ophthalmologists.
So sit back, relax, and enjoy an interactive insight into the training opportunities available to you. To kick things off, we have a presentation from our keynote speaker, Dr. Ash Coxton. Ash is a general practitioner and certified careers counsellor with a strong interest in assisting doctors and medical students with their career decision making.
Hello everybody and welcome to the 2021 PMCWA and AMA Medical Career Virtual Series. My name is Dr. Ash Coxton and I'm a general practitioner, career development practitioner, and I'm the founder and director of Medical Career Planning, which is a career planning and counselling service for medical students and doctors. I'd like to begin by thanking the PMCWA and the AMA for inviting me to speak to you all today about medical career planning, and also thank them for putting on such an amazing event for all the junior doctors and medical students of Western Australia. I'd like to acknowledge the traditional custodians on the land on which I'm on, which is the Bindal and Wulkurukaba people, and pay my respects to their elders past, present and emerging. So, how exciting, a virtual career series. Who would have thought years ago that we would have turned around and be doing virtual career series in 2021? But you know what? Here it is. It's very exciting, and I know that the PMCWA and the AMA have made this series as wonderful as they possibly can in the virtual environment, and I know you're all going to love this series. As I said, I'm a career development practitioner, and with the work that I do with doctors and medical students, I've learned lots of insights over the years about what doctors and medical students often wish they knew before they started their career journey. So I spend a lot of time talking to people who aren't really sure what they want to do or are early in their careers and don't have all of the knowledge available on what career to choose. And I also speak to people who are further on down their career journey and wish they'd chosen something else or wish they'd thought about other things before they made their definite career choice. So what I'm going to do with you today is take you through some of these tips and tricks that I've learned over the years from other doctors and what they wish they'd known at the start of their career journey. I hope you enjoy my talk today and good luck with your career planning. So the first thing I want to say to you is opportunity. You guys have the most amazing opportunity ahead of you. The career series that you're about to be exposed to is going to highlight so many wonderful medical careers out there, and there really are so many opportunities for doctors. It's really important though, as you go through this career series and even in your career planning, to understand that there are many medical careers out there and to increase your knowledge around these medical careers. One of the common things I do see as a career development practitioner is doctors who have chosen a pathway who said, I no longer like it, but I had no idea about all of the opportunities out there for me before I made this choice. Had I known all of the opportunities and all of the careers I could have trained in, I might have done something different. So if you aren't planning on attending all of these, watching all of the series as you go through this career series, I'd strongly encourage you to go to every talk, learn about every career out there, and to let it sink in and to know that maybe one day you might need this knowledge. Even if you're quite convinced you're going to do one pathway, you might need to know about all the other pathways out there. Inquire. Ask questions. If someone offers to speak to you about their career, take them up on that. One of the best things to do is to ask people who have done that specialty about that specialty. What do you like about it? What don't you like about it? And what do you wish you'd known before you started training? You'll find the most fascinating answers, which are going to help you figure out if that's the career you want to do. And network. Please ask questions, talk to people. As I said, ask them about their career. You might find yourself standing next to a forensic pathologist at a dinner function, or you might find yourself sitting down next to a medical administrator at a conference and you've never even heard of that career. If you haven't heard of a medical career, please ask them, what do you do? What do you like about it? And what don't you like about it? They're the key questions I think are very important to ask. So probably one of the most important things to do is knowledge and know about what medical careers are out there for you. How can you possibly know that you're absolutely sure that this one career is perfect for you if you don't know what else is out there for you? As I said, it's one of the really common things that people say to me, I wish I'd sat down and known about all those careers. So please, at the start of your career journey, find out all of the careers. There's actually over 80 specialties you can train in. That includes subspecialties, but over 80 specialties that the Medical Board of Australia recognises that you can specialise in. So don't just assume that you can only do the ones that you've been exposed to as a medical student. Sit down and learn about every career available. Where do you find the information? Well, your wonderful Postgraduate Medical Council of Western Australia has a very comprehensive website with all of the careers available for you to train in. It includes stuff such as workforce data, predictions about future jobs, who to contact if you're interested in talking about the job and what the job really is. So spend some time reading through that website, and things that you're really not sure that you might enjoy and you haven't heard about, or you've never even heard about this as a career, please spend some time sitting down investigating what that career actually is. The AMA also has an amazing information about what careers are out there, and I'd highly encourage you to go and look at their careers hub as well. Reflection. Reflection is the next part that's really important in your medical career. I know you guys are all good at it because you went through medical school, and I know that reflection is a very key component of medical school, and it is an important lifelong skill to have. Reflection is so important when you're trying to figure out what you want to do within your career, or if you're unhappy in your current career. So constantly asking yourself these things. What do I like about my current rotational situation? What don't I like about my current rotational situation? What do I like about medicine? What don't I like about medicine? And then once you've figured out those key things, are they modifiable or are they non-modifiable? So for instance, if you're really not enjoying your current job and you sit there and think, well, what is it about my current job I'm not enjoying? Well, I'm doing after hours internal relief. I don't necessarily hate medicine. I just really don't like being on night shifts. Is that modifiable? Yes, of course it is. You're not going to be on night shifts forever. Or you can choose to not go into a career that encourages or is all about night shifts. So once you can pinpoint exactly what it is you're not liking about your career, or what it is you do like about your career, you can start to then come up with a nice summary of things you're looking for in a medical career and try and find a career that satisfies that. The next thing, interests and skills. So important to know what your interests are and what your skills are, both inside of medicine and outside of medicine. So what do you like? Who are you? What do you like? What really interests you? What really makes you excited? Do you like knitting? Do you like painting? Do you like robotics? Do you like learning? Do you like studying? Do you like sport? What is it? Because once you know what really, really interests you, you can choose to actually try and tie that into your medical career. If you love robotics and if you love artificial intelligence, well, maybe heading towards an area like digital health or interventional radiology or areas that are really up to date with artificial intelligence is something that'll excite you. If you really love sport, maybe head down a sports physician pathway. But being very well aware of what your interests are keeps you really grounded in your medical career. And it also makes life outside of work lovely, that you have something else apart from medicine to keep you happy. What are your skills? So what are you actually good at? This is really important to also know for many reasons. Of course, you want to know what you're skilled at when it turns, when you want to apply for a job or apply for a training program, they're going to ask you, what are you good at and what are you skilled at? You need to know what your skills are. But more importantly, it's really great for self-confidence if you know what you're really good at. If you're kind of rocking that flow zone where you're really good at communication and you just get communication and, you're really wonderful at it, or you're a really good procedural operator and you're really good in surgery. It's really nice for you to know that, but it's also really nice to understand what those are, because you might construct a career pathway to head towards an area in which you are really skilled. Your values. Hugely important knowing what your core values are. If you don't know what your core values are, I urge you, this is probably one of the main things to do after this talk, is go away and find out what they are. What is a core value? A core value is who you are. What means a lot to you? What really deep down is what you really stand for. That is what a core value is. Is it ethics? Is it knowledge? Is it time and freedom? Is it family and friends? Is it intellectual satisfaction? Is it income? It's really important to know what is most important to you in your core values, because at the end of the day, moving towards a career that satisfies your core values is ultimately going to keep you happy in your career for a long term. If you find yourself working in an area or for an organisation that fits your values, you're going to be happy. If you find yourself in an organisation that doesn't fit your values, there's always going to be something that doesn't feel right. So please go away and learn what they are if you don't know. If you do know what they are, write them up, put them on a sticky note on your wall, and always remind yourself of what's really important to you. Your personality trait is also really important to understand, and I do lots of work with people around personality traits, and Myers-Briggs personality trait is something that I work a lot with, but any personality trait testing is important to know about and to understand that there are certain influencing factors on why we do things that are sometimes out of our control. And a lot of the time it's your personality, which is your subconscious control of what we do. But it's important to understand this, that sometimes these are going to have some influencing factors on our medical career, and sometimes it's not always a good thing. Sometimes there are blind spots in our personality traits that we need to be aware of. For instance, a really common personality trait in doctors is called a sensing personality trait. And these are people who believe what they can see, touch, taste, feel. They're factual, they're analytical, they're organised, and they really, really, really like external validation. So what I mean by that is they like knowing that the answers to everything. They like to know numbers, they like to know facts, they like to have evidence around things, which is a very critical part of being a doctor, and it's what we're taught to do. But sensates sometimes in that personality trait can rely on external validation too much. So when they get told that they're good at something by someone else, or when they get a good assessment form, or when they perform really well at an end of year assignment or exam, they can get mixed up in thinking that because they did well at something, that means they should do that career. So if they did really well in their gastroenterology rotation, that means that they should become a gastroenterologist. And this is a really common trait in medicine, particularly if a sensate is also a judging person who likes to have life planned. If you're not careful, you can turn around and say, hey, I'm really good at this and I want to plan my life to do this, and therefore I should do it. So you can see sometimes if you're not careful, your personality trait, particularly as a sensate, can sort of wipe out your strengths, your interests and your values if you're not careful. So be aware of that trait in particular. Last but not least, one of the most beautiful theories I've ever come across is a theory of planned happenstance. And this is by someone called Dr. John Crumboltz, who's a career theorist. And he says that indecision is desirable and sensible as it allows the opportunity to benefit from unplanned events. So basically, what that's saying is, if you don't know what you want to do, it's okay. Take this as a wonderful opportunity to learn, to seek, to inquire, to be curious, to look at all of the medical careers out there. Ask yourself, can I see myself in that career? Ask yourself, does that satisfy my interests? Does that satisfy my values? Will I be happy long term in that? And remember, it's okay if you make a choice of a career that you don't want to do in 10 years' time. You can always change your mind. It's just, medicine is a journey. It takes a long time to get to the end, and I really want you to enjoy the journey. Know who you are, know your interests, and enjoy yourself as you go along. Thank you for listening today. Enjoy the career series. As I said, my name's Dr. Ash Coxon. I wish you the absolute best of luck in your career, and if you have any time anyone wants to speak to me, my contact details are below. Enjoy.
Through our hospitals here at St John of God Healthcare, you have direct access to some of Perth's best surgeons and an opportunity to attend theatre and gain skills from those surgeons. We think that's a great chance for you to get a flying start in your surgical career.
It's great doing a surgical term at St John of God because the size of the department means that you have one-on-one contact with your consultants and also your registrars.
Not just mentorship that you get from them, but also surgical technicalities and hands-on skills and advice.
There's regular teaching sessions, there's grand rounds.
There is the ability to have direct patient contact in theatre and time in theatre, actually getting an idea of what happens to the patient in their journey all through from admission to discharge.
You're often working a lot closer with the consultants and the registrars. You get a lot of impromptu on the ward, hands-on teaching, that sort of in-the-moment experience, which is so beneficial.
Hello and good evening. My name is Dr. Dean Chung from Fiona Stanley Hospital, and welcome to the surgery panel that we've got on for the expo tonight. We're really lucky to have 3 representatives from the Royal Australasian College of Surgeons, who I'll introduce shortly. And just a reminder that we welcome questions at any time, which can be found by clicking the Q&A button on your screen. So joining me tonight, we've got first up Associate Professor Ming Yu, who's a consultant surgeon. We've got Dr. Helen Balau, who's a fellow of the college, and we have Dr. Munya Nandaro, who is a general surgical trainee. So welcome and thank you for joining us tonight. I thought we'd start off maybe just by introducing ourselves and maybe giving a short spiel on what you're doing at the moment and how you've gotten there. Prof, you can start us off.
Thank you, Dean. So I'm a general surgeon with an interest in endocrine, breast and laparoscopic surgery. I did my medical degree at UWA, subsequently internship Royal Perth, and surgical training through College of Surgeons, rotating through the tertiary hospitals in Perth, and subsequently a post-fellowship year in New Zealand, and have been practicing as a consultant for about 15 years back in Perth. Currently working at Royal Perth Hospital as well as St John's Subiaco and St John's Murdoch.
So my name's Helen. I'm currently the breast fellow at Fiona Stanley Hospital. And my surgical journey's been a little bit around the houses. So I started off as a UK graduate. I did my basic surgical training with the Royal College of Surgeons of England when there was a formal program called the BST, and then started higher surgical training in the UK. And then life brought us to Australia, where I then started again. So I did a few years as the breast fellow at Charlie's, followed by some service regging, and then completed the surgical program, the SET program here in Australia through all the hospitals in the WA area. I finished up by finishing the exams and doing the FRACs in 2019, and I've been the breast fellow at Fiona Stanley since. And then just to keep up with the general surgery, I also do some work up in Midland Hospital as well.
Munya.
Okay, yeah, my name is Munya. I'm a Set 3 general surgical trainee, currently rotating through St. John of God Midland Hospital. So I did my undergrad in nursing in University of South Australia, and then for postgraduate I did medicine at Notre Dame, and then upon graduation with the Pioneers at Fiona Stanley, first year 2015, did my residence there, then did a couple of years as a service registrar before successfully getting onto the training program.
Great. Thanks, Munya, and thanks everyone. Munya, I just thought I'd like to ask, as you're a current trainee, maybe if you could just tell us, I guess in a very condensed version, what's the nuts and bolts of the training program? How long is it? What's the usual application process? And when do people, I guess, usually start training? At what point in their career?
Thank you for that question. So with the training program, it's actually going to change from next year.
Okay.
So I'm on the last cohort of what is going to be a 4-year training program. From next year, it's going to go to a 5-year training program, which is divided into core and advanced training posts. And the current program I'm on is where you do 8 terms over 4 years, and usually you do your exam usually in Set 5 for the fellowship, and then proceed to do the specialization after that. In terms of getting onto the training program, I think it's something that you want to start to think about early, because with all the colleges now, it's very specific of what you need to be doing from early on. So you want to be thinking about doing the GSSE very early on, closer to internship as possible, because you're still more fresh into the studying mode. And then in terms of the requirements for the training program, you need to be well-rounded, so you need to be doing your research and getting the research points on the board, and it takes time to do those things. So you need to start thinking early and getting in touch with some mentors to point you in the right direction.
Right. That's very helpful information. Thanks very much. So we've got a lot of medical students and junior doctors joining us tonight online, and I just thought we'd go around the table and maybe talk about 2 or 3 things that you've really liked in your training and career so far. And we can start with you, Prof. Yu.
I found the training program fantastic because you get to work with some of the best surgeons in your city and all your training rotations. And you get exposed to a lot of challenging situations, a lot of situations that are very unique and very privileged position to be in, to be able to perform operations that can be life-changing for many patients. So yeah, it's a great learning experience through those years, and you develop not only your technical, your clinical skills, but also as a person, and yeah, I thought a training program was very valuable.
Great. It's good to hear. Yourself?
Yeah, and I do agree with that. So we are so privileged in what we do. It's true, they say every day is a school day. There's very few days you go home where you haven't either learned something new, a new skill, a new technique, a new trick, something new about yourself, something new about your patients. And we really do have specialities where we can, really connect with patients, and that's wonderful. You really connect with your colleagues. You get through some tough, stressful situations together, and you can really forge some good connections there. So it's a lot of fun. You get paid very well for doing that fun job, and that helps as well. And yeah, it's very privileged and humbling doing the job that we do, I think, and you see that all through training.
Amazing. Thanks for that. And Munya?
Yeah, yes, I couldn't agree more. It is quite a privilege to be able to do the job that we do. For me, being on the training program, it comes with its own challenges. Long hours, a lot of hard work, but at the same time, it's quite fulfilling work. When you get home at the end of the day, you feel like you've made a difference in your patients' lives. It is a well-supported program. It's an apprenticeship. So you've got the bosses there guiding you all the way through, teaching you all the tricks of the trade from what they've learned and setting you on a path. So it is well supported. So I would, yeah.
Very good. Thanks for sharing that, guys. We've got a couple of questions on the screen when someone's beat me to my question. We mentioned that there are some rigors of training, as with a lot of training programs out there. Mm-hmm. What are some of the things that you found in your training that were more challenging, so to say?
I would say there are significant demands on your time, and during the period of your time when you may be raising a young family, certainly my lovely wife had to act as a single mother for certain periods of time. So having supportive partner is quite important.
Yeah. Yourself, Dr. Val?
Yeah, so it's the same. I think you have to go into it with your eyes open and knowing what a demanding job it is. It's not just the time at work and working hours are being reduced, but it's the time that you want to put in. If you've got an operation coming up the next day, you want to go home and spend the night looking up that operation, making sure you know the steps, and that takes your time away. Your family have to be understanding, your friends have to be understanding of why you'd rather stay in and study when you've not got an exam, just because you want to do a good job the next day, because that's how we improve. Being a surgeon is not just about passing the exam, it's about doing the right thing for the patient and not causing any harm. So all those extra things take up your time. The research that you do, sometimes people say you have to do research to get on, and that's probably true, but it's much better if you can find some research that you're enjoying it and then you become passionate about it, and that takes demand on your time as well. So that's why I'd say it engulfs your whole life. So and as with everything, there's times when that's fine because it's enjoyable, and there's times when it wears you down.
That's fine. Munya?
I think in addition to all those, in terms of the challenges of time, I think for more of our junior doctors who are looking in from the outside, it's about the reality that it's very, very competitive program to get onto. So they have to be aware of that it's going to take a few goals, a few tries to get through, and that's going to demand a lot of sacrifice. To get onto the training program.
Yeah. That's great insight, thanks for that. I guess a good segue into the next question. How did you personally prepare yourselves for getting selected onto surgical training, things that you might have involved yourself in?
When I was, the time when I went through was a long time ago. And I think the process was a bit different. We had to pass a very rigorous exam, and the pass rate was 30%, and there was no shortcuts. You just had to put the hours in and memorize the content and be able to pass the exam. So that was my main hurdle.
So I think for me, the things that you need to get on the training program is you needed your good CV and you needed good references. And the way to get good references was to have a good work ethic and be around on the wards, put the hours in, get into theatre, and show that you were the type of person that your bosses would want on the firm, because it was less anonymous in the time now. I think now it's all anonymous. So you wanted the senior surgeons to give you the good references, because that really meant a lot. And then at the same time, you had to be working on your CV, so you had to be doing the unit audits, you had to be looking at getting posters for the presentations, and you had to be doing the minimum courses that you needed to do to get on. So there's usually the CRISP course or the trauma course, and making sure that all your CV points added up.
Great, thanks for
I think in addition to all those challenges, I think it's to just reiterate what I had said earlier, that you really want to start early because especially with the requirements for the training now in terms of the experience that you need to have, you need to commit early into the career path if you want to do surgery and make sure that you stay committed to the course, because there will be challenges along the way, but if you stay true to the course, then it's usually well supported and rewarding.
That's great advice. Thanks, everyone. So I guess we've spent a bit of time on what are some of the more challenging aspects and I guess what's required. I wanted to change direction a little bit and wondered if for each of you there was a light bulb moment that you had, whether it was a medical student or a junior doctor that really kind of confirmed your interest in surgery. And I guess coming from myself, you have someone who goes through med school and you're still kind of deciding what you like to do. So did you have a particular memory that you have?
Yeah, thanks, Dean. When I finished medical school, I thought that I would like to be a physician. And at the time, the Harrison's internal medicine was the Bible, and I'm not sure if that's still the case. But I thought it was pretty cool to be able to know Harrison's like the back of your hand. And but at the end of my internal medicine term as an intern, I decided that I couldn't fix anything with all that knowledge. I think as surgeons, we like instant gratification, where we perform an operation and we fix something, and it's a definite endpoint. And I think that's where a lot of surgeons get satisfaction from their work.
Great.
And yeah, for me, I went to medical school wanting to be a surgeon. Had no idea what that meant. Had nobody in my family in medicine, didn't know any surgeons, but just had in my mind that's what I wanted to do. Enjoyed rotations through medical school, but what really fixed it for me was I really didn't enjoy medicine and couldn't cope with looking in the sputum pot from the medical ward round every day. So surgery it was.
Great. Love the honesty. And when you for yourself?
Yeah, I think my light bulb moment, I would say it came when I was a theatre nurse, because I really quite enjoyed working as a theatre nurse. And time would go by, and I wouldn't realize how much time had gone by. And I think in that moment I knew that being in theatre, getting the technical aspects of operating is where I belonged. So I then just put my head down and pursued it.
Such a great story. And just looking on the screen, we've got one question that's really I guess been liked by a lot of people. And I thought, Dr. Glad, we were having a chat earlier, and you were saying when you were training, you were also raising a family at the same time.
Yeah, so I have done it both ways. So I started surgical training in the UK without any children, and that was easier to put the hours in, to stay behind to do the case, to be all engulfed by surgery. But then by the time I came to start the surgical program here, I had 4 children under 6. So that's been a challenge, but it's possible. I've been able to do it full time, mostly because that was my choice for how I wanted to do it. There are becoming more flexible options. The college is certainly supportive of flexible options for both men and women. There's certainly a lot more awareness out there now of how important that family life balance is, and in recruiting and retaining parents. So it's doable. It's hard work. And again, it's one of those things you have to go into with your eyes open, support a partner, childcare, backup childcare, and a degree of honesty with the people you're working for, to say, you can't stay late some nights for those reasons, and most people are very understanding. But yeah, it's been fun. The kids are still speaking to me.
Yeah.
They're none of them, are too mad, but they're good kids, and you can do it. And I think you learn to make the most of your time with them, and our family time is really special.
Yeah.
So yeah,
great.
Doable.
Thanks so much for sharing that. Prof, you were mentioning, we were talking before as well, and you were saying that you had the opportunity to do pioneer some surgeries in Perth when you were working. So maybe you could share some of your experiences with us.
Yeah, I mean, from a early medical career or medical student perspective, might be a bit far off. But in Perth, we are pioneering some Australian first operations and procedures, doing a thyroid operation without leaving a scar on the neck. Is one of those that we're in fact the first and the main groups doing it in the country. So it is possible that down the track that you extend yourself. Surgery is one of those realms that, as in any realm in medicine, there are always advances, and there's nothing stopping you from being at the cutting edge.
Great, it's very exciting. Well, I guess we're coming to the tail end of our discussion, and I just wanted to go through some of the audience questions very quickly. One was, what's there in terms of part-time training options in the surgical college?
So like I said before, the college is looking at some part-time options. We don't currently have any part-time set trainees, but that's changing rapidly. There are some part-time or some job share service reg general surgical jobs certainly around. The hospitals, the postgraduate departments in all the major hospitals are very keen to get flexible service reg jobs at least. So I think at the moment it's in its infancy, but there is an enthusiasm, and I think it's something that will take off very quickly. The UK has had a lot more experience on it. It's had less than full-time training going in surgery for at least 10 years successfully, where you can work anything from 50% to 80% of full-time. And I think the college is learning a lot of lessons from there. So possible, doable, and I think going to expand very rapidly soon.
Watch this space. Just wanted to, so I think we've had lots of great insight into some of the great parts of the profession. What are some of the, challenges in training? But it sounds like it's been a very rewarding career path for all of you. And just wanted to say thank you again for joining us tonight and supporting the Medical Careers Expo for 2021. Thanks very much.
Thank you.
Thank you.
Thank you.
I think I really recommend being a junior doctor here at St John of God's, just because you gain access to so many different areas.
The consultants are very available to you, and they're very happy to answer your questions, and they're always just a phone call away.
You are part of a bigger team in the hospital, and it's nice to establish those relationships with other healthcare professionals because you can learn from each other, and you actually need each other as well.
I think it comes down to being treated like an individual, feeling that you're a part of the team, feeling that you're being looked out for and cared for and developed and mentored as a junior doctor.
I would recommend future interns coming here, particularly because of the small teams, the learning opportunities that you get. There's a frequent amount of teaching.
Across St John of God Healthcare, your welfare and wellbeing will be of our utmost concern. We have multiple platforms and programs to support your growth as well as your wellbeing with us.
There is a strong sense of community, a strong culture of well-being, and a very caring, nurturing environment in which to develop knowledge and skills.
Hello, I'm Dr. Yasmin Solomon from the WA Country Health Service, and I will be your host today for the Obstetricians and Gynaecologists panel. A reminder to you all at home, you are all welcome to submit any questions at any time via the Q&A icon on your screen. Joining me tonight from the Royal Australian College of Obstetricians and Gynaecologists is Dr. Hong Lee, Obstetrics and Gynaecology Fellow, and Dr. Josh Thomas, Obstetrics and Gynaecology First Year. Thank you so much for joining us tonight, and welcome. We might start off this panel by, I'll give you guys a little bit of time to introduce yourselves.
Hello, my name is Joshua. I'm one of the first year trainees in Western Australia, Ranscog. I'm currently working at King Edward's Hospital, and I've just done the first 4 months of my training. Prior to this, I was an international medical graduate from Malaysia, and I worked in obstetrics and gynecology back home before I came over here to pursue my career in obstetrics and gynecology.
Hi, my name is Hong Lee. I'm currently a specialist in Joondalup Health Campus. I did my medical school in Queensland, and then I came to Perth in 2011 and started my training. I did all my training in WA, and towards the end of my training, I did some fellowship in Eastern State in Royal Prince Alfred Hospital and Chris O'Brien Lifehouse, and I'm currently enjoying my life in Joondalup.
Thank you for that. Josh, can you start us off by telling us a little bit about how to get into the training program and what it's like?
Well, the training program is highly competitive, as you would expect. It requires lots and lots of, I would say, time and effort and sacrifice. And if you are a family person, then a lot of understanding from your family members at home, because the hours that is required to prepare yourself prior to getting into training is really quite significant, I would say. It also requires an interest in obstetrics and gynecology, or an interest in women's health. As you know, there are multiple branches of women's health, and it all depends on which area of it that you want to pursue. But most importantly, I guess, firstly, would be for those that are thinking about a career in obstetrics and gynecology, it would be to think about having a good CV, a strong CV pertaining to obstetrics and gynecology. This includes doing research, doing volunteer work, getting as much hands-on experience as you can, publishing posters, presenting in forums, scientific meetings in obstetrics and gynecology, and with that, getting a placement in an obstetrics and gynecology unit, and then preparing for the interviews.
Thank you, Josh. And Hong, can you tell us a little bit about, from your experience, what were 2 or 3 good things about the training program?
So ONG is a very unique specialty where it is a specialty, but it's really, really broad. And you operate like a surgeon, you do ultrasound scan like a sonographer, you see patients in clinic with a lot of endocrinology in there. So it excites me in terms of like getting to know different scopes of medicine as well. And when you're in training program, whichever aspect that you like more, you can narrow it down and to shape your practice. When you finish your training program, you can just do purely sonology or gynae-oncology, fertility. So that's one of the special thing and good thing about the ONG and its training program. And the other thing is, uniquely to WA, I having gone through Eastern States, and I realized that the training program in WA is very, very well supported. I'm sure Josh will agree with that. Our officer in the college house is really, really caring and give all the attention to the trainee to ensure that there's really good well-being for trainees, fellows, diplomates, and everyone. So I guess it just feels like a good family, a nice family in town if you are involved in ONG training.
Great, thanks Hong. I guess a question for both of you guys is, in your experience, what are maybe some 2 or 3 not so great things about the training program?
Would you like to go first?
Oh yeah, not so good thing. Nothing is perfect in the world. So I guess like after all, ONG is still classified as a surgical training, surgical specialty, because we have to do obstetrics, some obstetric medicine, some ultrasound, like what I mentioned in the previous question. To get the case load to be confident and competent in the surgical aspect of gynecology, we need to take more initiative to get more training, get ourselves trained and be more comfortable, so that when we are qualified as specialists or consultants, we will be more comfortable with our practice. This is like with direct comparison with other specialty trainings like general surgeons, orthopedic urology, where all they do is focusing on their logbook, and there's no like the other aspect like labor ward and things. Again, focusing in the training program in WA, because we are geographically quite isolated from Eastern States, where Eastern States, they do offer more opportunity in some other fellowship, they are accredited or non-accredited. So as for trainees in WA, we have to really take initiative to expand ourselves or travel to Eastern State to get more of the training opportunities, if we were desiring to do some of the specialty trainings like gynae-oncology, urology, fertility, and such on.
And Josh, do you have anything else to add to that?
Yeah, I think some of the things that I felt were not so good what comes with the package is basically the hours. I would say the hours are really intense. I've got a family and 2 kids at home, so I'm very thankful to have them being very understanding towards my hours. But I think primarily it is the job satisfaction that drives probably both me and Hong forward. You know, in whatever we do on a daily basis, it's the patient-centered care, it's the outcomes from our work that really drives us. So although there may be some drawbacks to it, but I think the pros outweighs the cons in many ways, in many folds. Yeah.
Thank you both. We're getting some questions coming in from the audience. One that's come up, which is quite popular, is a lot of people these days for a lot of different training programs say that their training program is very competitive to get into. How competitive is it actually? That's the question we've got here today.
I've just got onto training last year, so generally obstetrics and gynecology or RANSCOG by itself has a maximum of 3 tries to get onto training. And you would not be surprised if you do go the whole night, you know, the whole distance trying to get into training. And there are some who don't succeed even after the 3rd attempt, which is quite sad, but sometimes there are reasons behind that. However, I feel that it is quite a challenging specialty to get on, because not only does it demand a lot of your time, demands a lot of your patience, it also demands a lot of your interest as well. And I think from a getting onto training perspective, if you are really, if you really can see yourself doing the profession, it will bear fruit in the end. Yeah.
Another question that sort of leads on to that is, while it's quite competitive and you're expected to do long hours, the people at home are wanting to know, does that get reflected sort of, financially, or is that just extra hours that you're expected to do to get onto training?
I can't speak for that because I'm only in my 1st year, so I probably don't have, I probably would not be able to comment on that at this current point, yeah.
Let's look at one of our next questions. So you sort of alluded to this, Josh. How many years, let's say on average, does it take for you to get into training post-medical school?
I came from a slightly different pathway. I'm an international medical graduate, so I graduated in 2010 and I worked for 6 years in Malaysia. And in 2016, when I came over, there were many hurdles and loops that I had to jump through, primarily trying to get into an obstetrics hospital, and then getting my PR, and subsequent to getting the research work that I required. So that took at least 3 years for me before I attempted my first interview, and I got onto it on my 2nd interview. So it was a bit of a challenge. So I am technically PGY 11 this year.
I'm a bit different. So I graduated and worked as an intern, and I was on the 1st year training program when I was PGY 4.
So it seems like there's a real range just depending on what your career path is like. And yeah, okay. And another good question is, are there good job prospects once you've finished your O&G training?
I guess you can get a job anywhere as long as there's like babies, pregnancies. And of course, like O&Gs, there's obstetrics and gynecology. I would say our workload currently is about 70-80% obstetrics, and gynecology is about 20-30%, unless you are subspecialist in a specific field like oncology or fertility. There's always a job demand, I guess.
Great, thank you. Something else that you mentioned earlier was there seems to be a lot of subspecialties in O&G. Can you just, I guess, name a few just so that people at home are aware of what's out there?
So there is gynae-oncology, there is urogynecology, which deal with more urology aspect, incontinence, and then you've got fertility. You've got ultrasound sonology training with high-risk pregnancies and things, and also maternal-fetal medicine. Did I leave out any?
No. Okay. And fertility.
Fertility, yeah.
CREI.
Perfect. That's all we've got time for today. Thank you so much, both of you, for joining me today. It was really great to have you on. And just a reminder to everyone at home, please don't forget to provide feedback for this panel via the feedback icon. Thank you so much.
The GPs in regional WA are very skilled. They have, of course, their specialist GP training, which they do, which enables them to really have a broad knowledge base and to be able to treat the whole patient and the whole family.
So we kind of have a tiered system here, really. We have the emergency specialists as well as GPs, and they work side by side in the emergency department. And it works really well for patients because they get that continuity of care from general practice, and it's quite a different viewpoint from the general practitioner as to an emergency consultant. So there's very different skill sets.
GPs are the medical lifeblood of small country towns. I'm a small town person, so I'd encourage them to be a GP in any small town throughout the country, and I think they fit into the community and love being part of the community. I think they'd find that a very rewarding pathway if that's the way they wish to go.
Hello, I'm Dr. Gemma Hogan from the Department of Health, and I'll be your host for the Paediatrics panel. A reminder to you all, we welcome your questions at any time by clicking on the Q&A icon on your screen. Joining us today from RACP, Paediatrics and Child Health, is Dr. Rachel Collins, a general paediatrician and Director of Paediatric Education at Perth Children's Hospital. She is also a Senior Lecturer in Paediatrics at the University of Western Australia. We also have Dr. Megan Nettleton, the Medical Education Registrar at PCH, who is a General Paediatrics and Paediatric ICU Advanced Trainee. And lastly, we have Andrea Megan, Immunisations Registrar at Perth Children's Hospital, who is a General Paediatrics and Community Child Health Advanced Trainee. Thank you all and welcome. Rachel, I might start by asking you, can you tell us a little bit about the paediatrics training program?
Yeah, sure. So obviously we're all real enthusiasts for paediatrics training and would say it's absolutely the best training program that you could possibly do. So for those of you who possibly already heard a little bit about basic physician training, the structure is essentially the same as it is for paediatric training. So you're looking at a 6-year program minimum. There's 3 years of basic training. Most people will get through in 3 years unless you want to prolong training for part-time training or want to take a break or anything like that. And then 3 years of advanced training, which many people also do additional dual training of subspecialties along with that. So often that takes longer than 3 years, but it's 3 years at a minimum. So the basic training has a very set structure that goes with it, and basically there are certain criteria that you want to fulfill during that 3 years, which includes neonatal training, subspecialty paediatric training, general paediatrics, and non-core, as well as emergency paediatric training. And then come the lovely exams, which everyone always looks forward to, and that is a little hurdle to get over at the end of your second or third year of training, and then into advanced training where you get to select a little bit more what your training looks like. And there are some core features of advanced training for general paediatrics that you need to fulfill, such as rural training and perinatal training. But you can also have a little bit more oversight as to what you choose to do in terms of developmental or subspecialty training in addition to that.
Great, thanks for that great overview. Andrea and Megan, what obviously as trainees, you guys probably have a few views on things. What are 2 or 3 good things about training?
I think for me, one of the best things about paediatrics is that you can enter basic training knowing that you love working with children and you're going to be a paediatrician or a specialist in paediatrics, but that then you can go on and do the multiple different advanced training specialties, so that you can be a paediatric cardiologist, a paediatric neurologist, you can do paediatric rehab, or you can do just plain general paediatrics, and that's just to list a few of the probably 20 or more specialties that we can do. So I think that that's a real advantage of our training program. And that there's just one set of exams, so a written and a clinical exam that are in the middle of your training, and once you've done those, for most of the other specialties there's no further training examinations, so that's a real bonus for a lot of people as well.
Great. Yeah. Did you have any views?
Yeah, so I agree. I think it's it's really fun work. It's a really places that paediatrics are really fun places to work, and most people want to be there and enjoy it. And it's really satisfying intellectually as well. And then I find the college fairly flexible in terms of, you know, interruptions of training and leave and doing things in different orders. To some extent, they've been really good.
Yeah, great. So obviously we've talked about some of the good things about the training program. Could you guys maybe give us an insight into 2 or 3 things that are difficult about paediatric training?
So the exam is really hard, or the exams are really hard, and some people feel not necessarily what is required to make you a good or safe paediatrician, and you know, that's a good 18-month slog at least to get through both of the exams, and the held once a year-ish. See how that goes in the future, which adds to the pressure. So same as physicians training in adults, that's hard.
Yeah. Okay, looks like we have some questions from the audience, so I might just ask this one. They said, what is the pathway if someone is interested in, for example, paediatric surgery or ICU? Megan, I might go to you with this one.
I actually went to PMH as it was to do paediatric surgery, and have since added ICU training, so I'm hopefully fairly well placed to do it. Paediatric surgery as with anaesthetics and ICU are all different training programs. Surgery is through the Royal Australian College of Surgeons and has its own application process, though a lot of people will work as RMOs at the Children's Hospital and then go on to do service surgical registrar jobs, requesting terms in paediatrics at PCH. But the program entry is through the College of Surgeons. Intensive care have entry through the College of Intensive Care Medicine, which you can actually join as a basic trainee in intensive care through an adult pathway and do advanced training in paediatric ICU, or you can do what I've done, which is a bit of a hybrid where I'm dual training. I've done most of my general paediatric training, including advanced training, and there are entry pathways where you can essentially join onto the advanced training section of ICU, as long as you have or you will receive your fellowship before your exams for one of the acute care colleges, so ED, anaesthetics or physicians. Mm-hmm. That's as a rough guide.
That's a rough guide, great. Yeah, that's great. We're getting some more questions in. So the next question is, what advice do you have to prepare to apply for paediatric training, and what did you have to do to get into training? So again, I might open this up to the panel.
Yeah, so I think I'm probably best placed to answer this one. So my role is Director of Paediatric Education. So myself and Tim Ford, the other DPE, hold the keys to training. And basically what the process involves is that we generally will take trainees from PGY 2 and above, though we prefer to take PGY 3. And the criteria for applying are that you need to have a contract at PCH for 12 months prior to getting on to training. So usually the recruitment starts at the beginning of the year, around about February for that. So you'll already have that in place by the time you go through the entry into training process, which usually takes place around about August to September. And basically what that involves is writing a cover letter, which would be a scored cover letter, and a CV, which needs to be a well-rounded CV that shows some interest in paediatrics, research, education, and generally addresses all aspects of what we want from a good paediatrician. If you get through the scored CV and cover letter process, then we go to interview, which is multiple mini interviews, 5-minute interviews, which are like mini OSCE stations where you address a range of PEDS-related issues, and then from that will be ranked and
potentially offered a place in paediatric training. If you've got a job at PCH as an RMO or a reg for the year, whether or not you get into training won't affect your ongoing employment. It'll just affect the terms that you have going forward from there and whether you're on training.
Yeah, great, thank you. Another question that's come through is, what postgraduate year do you generally need to be to apply to and get into paediatrics?
Are you happy for me to take that one?
Yeah, sure.
So preferably PGY3. We will look at some sort of shining stars in PGY2, and potentially from 2022 we're going to be looking at having some interns at PCH which are seconded from other sites, but you won't be eligible to get onto PEDS training at that stage. It'll just be an opportunity to get some PEDS experience. So realistically, year 3, but potentially year 2. We're happy to look at applications from year 2. There's just a slightly less chance of getting in. And I just want to address a question as well about whether or not you actually need to have completed advanced training to be a consultant. And the answer to that is yes, you absolutely have to do both parts of training. The training isn't complete until you've done basic and advanced training and completed your exam to get your FRACP.
Great. Thanks for that. I think one of the other questions that's coming through is around components of your CV. And so is there any particular things that junior doctors or medical students should be focusing on in order to maximise their chances of getting a position?
I think you're best placed to answer this, being the one to looks at CV.
Yeah, so basically it doesn't have to be PED specific, so we want to see that you've done something like an audit or shown some research in quality improvement. If you've done some medical student teaching or showed some interest in supervision or mentorship. If you've done anything PED specific, that's great, but it doesn't have to be PED specific. Some people will have done things like Teddy Bear Hospital or Radio Lollipop or volunteer work. So we just basically want to see that you're well-rounded, that you've done more than just the bare minimum in terms of your pre-medical and post-medical school career, and during your intern year as well. So just ambitious, keen people who wanted to look after kids.
Yeah. Great, thank you very much for your time all. I think that comes to a close. Please don't forget to provide any feedback for this panel via the feedback icon, and thanks for your time.
Thanks.
Hello, hope you're having a nice evening so far. I'm Dr. Dean Chung from Fiona Stanley Hospital, and we're very lucky to have a representative here today from the RACP's Australasian chapter of Palliative Medicine, and we have Dr. Dylan joining us, who's a consultant palliative care physician. So just a reminder, questions are welcome at any time and can be submitted through the Q&A tab on your screen, and we'd love to hear what your thoughts are. So Dr. Dylan, over to you. Just thought to start off by telling us a bit about yourself.
Palliative care physician. I'm actually trained from Adelaide and actually started as a general practitioner through training and found palliative care interesting, and then went ahead and trained as a palliative medicine physician. From Adelaide then made the big move to Perth and been in Perth ever since.
Great. And just a bit about the, training pathway that you've outlined for yourself.
I guess palliative care is unique in that way. So even though we sit with the College of Physicians, to get into training, you need to hold a fellowship. So you actually can be, a fellow in emergency medicine, psychiatry, for example. But for me, as you said, I'm a general practitioner, predominantly GPs and physicians. That's how they come through into palliative care medicine training. So that's the uniqueness of palliative care compared to the other subspecialties.
Yeah, great. That's very cool. Dr. Lim, we've got a lot of medical students and junior doctors joining us tonight, and just wanted to get your thoughts on what are some things you've really enjoyed in your training and career so far?
So, everyone does think palliative care is doom and gloom, but it is very rewarding to be a palliative care physician, even though, you may not choose to specialize. A lot of them do decide to do 6 months of a diploma in the area. It is very rewarding, caring for someone with a life-limiting illness. You not only care for the patient, but it's also caring for their loved ones, family. So it's very holistic medicine, and that's really what attracted me to training in palliative care medicine.
Great. Dr. Dillon, was there a point in your medical school training or your career as a GP where you kind of had a light bulb moment?
So for me, so for me, it was really as being a GP in the rural setting. For me, caring for someone with terminal illness, you sort of looked after them, while they were having sort of what we call active treatment with chemotherapy, etc. But then, towards the end, when treatment or the cancer progressed and treatment wasn't working, that change where you sort of care for them, making sure that they're comfortable right to the end. And for me, I cared for that particular patient at home, and supporting the family and being there for them to support them through that difficult period. That was that light bulb moment for me, really. Yeah.
That's great. Thanks for sharing that.
Yeah.
Now, I guess in my own medical school experience, palliative care wasn't a big kind of rotation area. And a lot of people, like you say, may think it's a doom and gloom area, but as you said, there's some very rewarding aspects. What were some of those challenging aspects you found in your training and career?
I think the challenge has really been, where patients really struggle when you sort of say, there's no more active treatment. I think, that difficult conversation that you have, for example, with the oncologist, being part of that team, that can be sort of quite stressing, to the patient and the family member, and always be mindful how you feel in that particular situation as well. And there have been challenges, and even as a consultant, I'm sort of 4 years into being a consultant. I do still have senior consultants that feel that stress, or where you sort of not really, you sort of are not giving hope in terms of curative treatment, where you then really need to support them and making sure that they understand that yes, no treatment doesn't mean that you are not being cared for anymore. There is ongoing care as a palliative patient in the with palliative care follow-up speciality.
Great, thanks for that. I guess for people in our audience tonight who have maybe thought of palliative care as a career option, what are some things you did yourself to prepare yourself to get onto training?
So in terms of getting onto training, most definitely, flagging with the senior clinicians. So, for example, in Perth, making yourself aware to the senior physicians. The physicians up at Charlie's, for example, they do sit on the board in terms of picking trainees. And for example, as mentioned earlier, if you're not quite sort of, how should I say, set on being a palliative care physician as a speciality, definitely doing the diploma in palliative medicine, which is a 6 months rotation, would be a good stepping stone to sort of see what palliative care medicine is, and it looks good on your CV either way.
All right, that's great tips. How would someone get involved in that diploma of palliative medicine?
So once again, that's part of the sort of interviews for sort of getting into the program. So if you're not sort of quite set there yet. You can still go for the interview and sort of say, I would want to do a diploma, and yeah, sort of as I said, it's a good stepping stone. But the application process is through the same channels. Yeah.
Great. Thanks for that one. We got a couple of questions coming from the audience tonight. One of the kind of central themes I've got is, what's your typical day like? What's the working environments you can be involved in terms of private practice, for example, or community or hospital?
Yeah.
Yeah, maybe you can share a bit on your...
Yeah. So once again, for WA, the uniqueness is that so you've got the multiple areas. When I say multiple, you have inpatient hospice, you have community palliative care, and a consult role. So for me, so I'm predominantly as a consult physician. So I work in sort of acute hospital. So I work at Joondalup and St John of God Midlands. So sort of seeing patients from that end, and then sort of caring for them in hospital or referring them on to hospice, or discharge planning to community palliative care. So that's once again the uniqueness of palliative medicine. You can sort of choose as you finish up training what particular area that you're interested in, and really then focus in that particular field.
Great. It's good to hear there's a lot of variety, I guess.
Yeah.
That particular training pathway. So I guess coming towards the end of our panel discussion tonight, is there anything, I guess, if you could look back and wish you knew before training, or advice to your younger self about palliative care?
So for me, it's obviously keep an open mind, sort of really get a mentor to begin with. You'll have to have a formal supervisor for your terms, but really pick a mentor. So I really did that in the middle of my training, and doing it starting as you start training would be ideal, so that he or she can really guide you along the way. And as mentioned, you are going to have difficult conversations, difficult sort of experiences, and making sure you can sort of debrief with that person, someone that you're comfortable with, would be my really strong suggestion to trainees. And a lot of physicians these days, it might be a bit separate, but a lot of physicians do choose to do two sort of pathways. Do train in palliative care, but do have training in geriatric medicine, sort of dual trainees, or even oncology and palliative care. That also could be something that some trainees or junior doctors might be interested in. A lot of the new trainees that are coming out are dual trained, and I do have someone back in Adelaide who is a GP who still works as a GP, but does have sort of some work as a palliative care physician as well. So a good mix, and yeah, that's the uniqueness of palliative care from that end. Yeah.
Thank you so much, and thank you for joining us, Dr. Lin, tonight, and giving your insight into palliative care medicine.
My pleasure. Thanks for having me. Thank you.
The reason I picked St John of God, I really enjoyed the aspect of the close relationship one gets with the consultants and consultant level decision making and thought processes.
So it's a really supported environment. You really feel that you are part of the team, and they will help you if you need it.
We have a well-developed teaching program, and both formal and informal at the bedside.
I feel the education one gets in St John of God's healthcare is second to none, and it's led by some of the best specialists in the state.
And also because the teams are small, you get to step up pretty quickly as well.
Working in St John's of God gives me the opportunity to be able to experience all the rotations that are required towards my career.
I really recommend being a junior doctor at St John of God Healthcare for the teaching, the experience and the mentoring that you'll get at second to none, and you'll have a fantastic experience.
Hello again, I'm Dr. Yasmin Solomon from the WA Country Health Service, and tonight I'm the host for the radiology panel. Joining me tonight is Dr. Janelle Morris, Consultant Radiologist and Director of Training at Fiona Stanley Hospital, and Dr. Samantha Tan, third year radiology trainee. Just a reminder before we get started, for everyone at home, please feel free to submit your questions at any time by the Q&A icon. Now, to start us off, I'll invite Janelle and Samantha to tell us a little bit about themselves.
Thanks, Yasmin. So my name's Janelle. I'm one of the radiologists at Fiona Stanley Hospital.
I did my radiology training in Perth, and it's across all sites, so Royal Perth Charlie's and Fiona Stanley. I then went and did a one-year fellowship in women's imaging in Toronto, and now I work at Fiona Stanley Hospital.
Thank you, Janelle.
Hi everyone, I'm Sam. I'm just one of the third-year registrars, and I'm rotating. We rotate around, and I'm currently at Fiona Stanley Hospital. I trained in Northern Ireland and arrived in Australia about 5 years ago, where I did just a range of RMO jobs, mainly in ED and ICU, and realized that I wanted to do radiology 3 or 4 years ago, and here I am.
Perfect. Sam, can you tell us a little bit about what the training program entails, what it's like, how you get on, etc.?
So it's a 5-year training program. You rotate around the 3 main sites, so Charlie's, Fiona Stanley Hospital and Royal Perth, with a couple of peripheral hospital sites in the private sector, and also PCH. How to get in, it's an interview process. It's quite competitive, so there's quite a lot of preparation and courses and different things to do before getting on. And the training program it's small, but it's really great. It's really supportive, and there's a lot of teaching and learning constantly. So,
perfect. Janelle, anything else you'd like to add to that?
So you can get in after your 2 years of postgraduate training, so apply in your second year at the earliest to get in your third year. Obviously, we like people with maybe a little bit more experience, and certainly people have definitely gotten in their third PGY year. We just look for a real drive for an interest in radiology and people suitable to the training program.
Great. And in both of your experiences, what are 2 or 3 good or great things about the radiology training program?
It's a really supportive environment. So I've done a couple of jobs in other specialties, and I found that this has been extremely supportive in a way where consultants are always happy to check your work, give you advice. Colleagues and other registrars are always happy to teach and show you interesting cases they've seen. The teaching program is very robust. You get paid protected time every week. And there's a lot of extracurricular teaching sessions and tutorials that people are happy to put on out of hours to teach you. So that's one of the great things I've found, mainly the very supportive and nurturing environment. Other good things about radiology is that just the breadth of knowledge and medicine you get to learn is really exciting. So you can get to see really, really acute things from stroke, bleeding, to sort of more outpatient things, and there's a lot of procedures involved as well. So if you're interested in that, it's a great opportunity to do a lot of MSK injections, drains, even IR. So it's all very exciting.
Just leading on to that, actually, we've got a question from the audience about what the pathway is like to get into interventional radiology. Can you tell us a little bit about that?
Sure. So the pathway to get in is exactly the same as getting into radiology in general. So you'd be selected as part of the selection group of each year, for which the current applications had just opened last week, actually. Once you're in, you go through and do quarter-year rotations through different subspecialties. So interventional radiology is one of them. If you've got a high interest in interventional radiology, you might ask for more than one term in interventional radiology. And then the key is after you finished your 5-year training, you might go on to do an interventional radiology fellowship, if you're looking to work in that area post-graduation.
Perfect, thank you. Another good question that's come in is that there is not a lot of exposure to radiology in medical school or in internship. So someone who's interested in radiology, or if they're not sure, how do they get exposure to radiology as a specialty?
So there are lots and lots of radiology meetings, which are really good to go to whenever you're doing your rotation in hospitals. So nearly every specialty has, a MDT where they show a lot of imaging, and they speak about how to manage the patient, and that's a good way to get exposure. Other ways would be to actively organize electives or really more observerships, but that's maybe more whenever you're in your junior years as a medical doctor rather than medical school. But yeah, we are very friendly people despite our reputation, and we actually do like speaking to people. So whenever you're doing your rotations in hospital, it's really great to come down with the doctors you're on with to speak to the radiologists and see how things are doing, see how we can work together to get the best way to manage patients.
Anything to add to that, Janelle?
I agree. I think one of the best ways Sam mentioned was you can organise an observership with any of the hospitals. That way the staff at the hospital can meet you and then they can put a name to a face at interviews if you're going to apply. Also, if you're at the Charlie's group, there is a resident rotation as a junior doctor, so you can experience interventional radiology through that.
For our next question, I'll get both of you guys to answer it separately. So what does a typical day look like for you?
So the typical day usually starts about 8:30 to 5. There's usually a couple of MDTs in the morning that I like to come early to go to because they're really good for learning. And then usually the morning session, afternoon session, depends on what hospital you're in. It can be modality based, or you just report and then you check all your reports with one of the bosses at the end of the session, and you get one-on-one feedback about learning and teaching. And sometimes, depends on what hospital you're in, you could be allocated to a procedural role where you can do ultrasound guided procedures like injections and drains. Is there anything else?
So my typical day today, for example, I was in the breast clinic today. So that involved seeing high-risk breast cancer patients for follow-up to see if their lesions were something aggressive. So each patient was worked up. We did ultrasounds on each one individually and then did biopsies where needed. So we had a lot of patient interaction today.
And we've also got a question coming through specifically for Sam. Yep. How did you find assimilating into being an RMO and into a training program as an IMG?
So I studied in Northern Ireland, so it's a UK training program, so it's actually very similar to the programs here, so there wasn't a huge difference. I think there were a couple of small, different things with how things are run. I did a couple of years in ED and then majority of my time in the different ICU departments in South Metro before deciding on a specialty. I think it took a little bit of time for me personally to figure out what I wanted to do. But it actually was relatively easy. I think the slight difficult thing about being an international medical graduate is maybe you don't know the departments as well before you start applying. So I think it takes a bit of time to kind of build up some rapport, figure out how things are done here and what the application process is. But otherwise, there's no difference between where you went to medical school. It just depends on your own merit.
Perfect, thanks. Another good question is, what's the work-life balance like? Maybe we can say as a registrar and then as a consultant.
Great. I found, especially because I was doing a lot of shift work in ICU and ED before, radiology is great in a way where majority of your time you are working in hours and obviously some evening shifts and weekends and nights, but generally the work-life balance is really good. There is a very heavy emphasis on studying like self-directed learning at home as well. Just because, if you don't keep up a general good rate of studying, it'd be very difficult to do your job effectively. So in that way, I think there is, coming into radiology, you need to realize that it is not just doing the job, there's a lot of additional effort and hours to put in by yourself as well. But otherwise, the work-life balance in terms of hours at work is great.
Perfect. And we've just got a little bit of time left. So Janelle, as a consultant, what would you think the work-life balance is like?
It's actually a good ending point, is that it's great as a consultant because radiology is one of those careers where there's less of an emphasis on continuity of care. So you could work 2 days a week or you could work 4 days a week. It doesn't really matter. And you can choose to work evenings if you want and not days. So there's a lot of plasticity in the way that you work and so many different types of jobs that you could do that the world is your oyster with radiology, I think.
Perfect. Thank you both so much for joining me tonight. That's all we've got time for. And everyone at home, please remember to submit your feedback on the screen. Thank you.
Thank you.
Hi, med students and future interns. I'm Deepan, the Deputy Director at Charlie's. Chris, what do you like about working at Charlie's?
It's the place to be. Because
because of the really good rotations.
Great sort of research and learning curriculum.
The very, very supportive staff.
It has a great working culture.
It has really good teaching.
Everyone's so nice and supportive. It was close to my house.
Haematology, which is the only hospital in WA that allows interns to do it.
Willingness to teach.
Training opportunities. Well supported place to work. Everyone's been friendly. Cinnamon scrolls.
It's great. Friendly.
My supportive friends and colleagues.
The patient complexity.
Great for BPT training. A whole range of pathologies and interesting stuff.
For the surgical training program.
Plenty of research opportunities.
It's a homely place, so I don't know what else to say.
Hello, I'm Dr. Gemma Hogan from the Department of Health. I'll be your host today for the ophthalmology panel. Just a reminder to you all, we welcome your questions at any time by clicking on the Q&A icon on your screen. So joining us today from the Royal Australian and New Zealand College of Ophthalmology are two registrars. We have Dr. Nish Davidos, who is a second-year ophthalmology trainee at Fremantle Hospital, and Dr. Ben Host, who is a final-year ophthalmology trainee at Perth Children's Hospital. Welcome, and thank you both for coming. I might start by asking, can you please tell us a little bit about the ophthalmology training program? Ben, I'll start with you.
So yes, the ophthalmology training program is a 5-year program. You have 4 years of training as a registrar, and then 5th year is fellowship. So in the first 18 months of training, you sit your basic sciences examinations, whilst also working clinically. And in your 3rd year, you sit an ophthalmic pathology examination. And then in your 4th year, you sit the RANSCO Advanced Clinical Examination. So once you've done that and you've done your clinical training time, then you can apply for fellowship, which usually takes place usually interstate or overseas, although things are a little bit difficult at the moment with COVID to get that happening.
Yeah, fair enough. And Nish, do you have anything to add to that?
Not really. I guess it's just between one exam to the other.
Yes,
yeah.
That's right.
Yeah. So then I guess what are 2 or 3 good things that you find about ophthalmology training?
It's a great balance between the clinical aspect of it and the surgical aspect. There's a very good balance in between. It also gives you a very good work-life balance as well in terms of the hours that you have. From a very professional point of view, you also get very good exposure to the various subspecialties that are present in ophthalmology as well.
Yeah, great. And what are maybe 2 or 3 things that you find difficult about ophthalmology training?
I'll take this one, if I may. So I agree with Nish, it's a great training program and we're very well supported by our seniors and have great learning and great teaching opportunities. As Nish alluded to, there are lots of examinations which involve a fair bit of study, and it seems like you just finished one and you're on to the next one. On call can sometimes be challenging when you work all day and then are on call at night on those occasions when you have a couple of emergencies and spend it in the hospital. But overall, that's not too bad. And I think the main thing is Nish alluded to work-life balance, which is quite good. However, when you're studying for exams, it can really take you away from your friends and your family for extended periods of time.
Yeah, definitely. So how did you both prepare yourself for getting selected onto the ophthalmology training program?
So it comes down to looking at what the college requirements are. So when you actually go to apply for the training program, they look at your CV, your referee scores, and from there, depending on how good that is, they might offer you an interview from there. And once the interviews are conducted, you then find out whether you get a state-based interview. So they've recently moved from a state-based application process to a national application process instead.
Yeah.
So in terms of preparing for that, I think most importantly is to ensure that you're a good doctor. And by that, you don't just get a single-minded focus on ophthalmology as your profession, but all the different rotations that you go through, all the opportunities that you have to make the most of those. Because
absolutely.
They're really important, not just for getting in, but also for being a good ophthalmologist. The better doctor you are, the better physician you are, the better ophthalmologist you'll be. You can look on the college website. There are different what's the word I'm looking for? Different attributes that they want in ophthalmologists. So scholar, educator, medical expert, professional, all of those sorts of things. So you can have those in the back of your mind as you're going through medical school and your junior doctoring to look at different ways that you can be involved in certain things that might tick those boxes, for want of a better term, when you're applying for the training.
Great, okay. It looks like there's a few questions that are coming through now from the audience. One of those is, a few people have said that we have to go east as a JMO or as a service registrar to get accepted onto the ophthalmology training program. Is there any truth to that?
I don't think so, no. In fact, looking back at the past 5 or 10 years, I can't think of anyone who wasn't actually either a resident or a service registrar here who was given a training spot here in WA.
Yeah, so there are often within WA, you usually have to work as a service registrar prior to getting on as a trainee registrar. There are oftentimes some more opportunities over east as a lower PGY to get onto training program, where in the bigger networks such as New South Wales and Victoria, where they take on more trainees, they're able to take on some trainees that are perhaps a little bit earlier on in their careers.
Yeah, okay. Another question that's coming through, what are the requirements to get onto the training program?
As Ben alluded to, realistically, first and foremost, you need to be a good doctor. And you also need to have a keen interest in ophthalmology. From there, it's really about harnessing your experience that or rather sort of furthering your experience in ophthalmology, and then ticking the right boxes in terms of applying for the actual training program.
Yeah. Another interesting question that's come through is, they said, must you want to operate to be an ophthalmologist? Is it an essential requirement of training?
Good question. I think if you don't want to perform ophthalmic surgery, then ophthalmology is not the specialty for you. We are eye surgeons. We do lots of medical interventions, but we do perform surgery, and that is a huge part of our training and a huge part of our careers.
Yeah. Another question that's come through from the audience is, how many trainees are taken every year in WA? And you guys might know a little bit more about that.
That really varies from year to year, depending on how many trainees are actually finishing up the training program. So it can vary from anywhere from 1 trainee to even a couple of years ago, we accepted 4 trainees within the same year.
Yeah, so that's probably the range, but it's usually about two to three trainees per year.
Yeah. Okay. Is there anything in particular that you would recommend, I guess, to medical students or junior doctors in terms of bolstering their CV to tailor it more towards ophthalmology?
That's a very good question. So again, I'd direct you to the college website to look at those, the different characteristics of an ophthalmologist. So lots of people get really focused on research, and yes, research is really important, but it's not the be-all and the end-all. There are advocacy things that you can do. There are teaching things that you can do that really do count towards you being an ophthalmologist, being, as we said, a good doctor and a good person. And if you're a medical student, when you get the opportunities to be in eye clinic, knowing something about the eye, being engaged and being keen, and impressing the doctors there, as you should in every rotation, is really, really important.
Yeah. That's great, thanks. And then another question that's come through is, what terms do you recommend as an intern or as a RMO that would help you get onto ophthalmology training?
Probably suggest broadening exposure as much as possible, because any skills that you actually pick up in almost any rotation can be applied in some way, shape or form when you actually do ophthalmology. If you're trying to refer to specific things, specific subspecialties, probably things like neurology, I think can be quite useful. But certainly, when it comes to things like surgical skills, any surgical subspecialty will give you the necessary skills that you actually require.
Absolutely.
Yeah. Another question I guess we have is, what do you wish that you knew before entering ophthalmology training? What advice would you give to your former self?
Oh, that's a good question. I wish I knew how rewarding it was and how fun it was as a trainee, and I guess that probably would have piqued my interest even more. But I wish I also knew how difficult it can be to spend long hours away from your family and kids, if you've got them, when you're studying, particularly for your final exams. It's a really big undertaking. So go in with your eyes open, if you pardon the pun. Expect it to be difficult, but expect it to be really rewarding, and it's a great career.
Yeah.
Best job in the world.
Yeah. Anything else you'd like to add to that, Nish?
Look, that's really, I think you summed it up
pretty well. I think you can end on best job in the world, probably.
Best job in the world.
Yeah, that's pretty good. All right, well, thank you very much, both Nish and Ben, for your time today. Please don't forget to provide any feedback for this panel via the feedback icon, and thanks for your time.
Thank you for having us.
Yeah, thank you.
everyone. My name is Dr. Dean Chung from Fiona Stanley Hospital, and I'm very lucky today to have Dr. Amanda Ireland joining us from the Royal College of Pathologists of Australasia. Welcome, Amanda. Thanks for joining us.
Thank you for having me.
So we're going to go through a few questions tonight, as a lot of the other panel discussions have, and as you think of any questions along the way, please feel free to submit them through the Q&A section. And Dr. Ireland, I just thought I'd start off and maybe you could tell us about your own kind of journey in pathology and where you're about to be working at the moment.
I'm a dermatopathology fellow at Sir Charles Gairdner Hospital. So I work with the pathology and the clinical teams.
Okay, great. And how did it go in terms of your how long pathology training took, or when your exams were and things like that?
Yeah, okay, so our training it's usually 5 years. It can be 6 years if you take a bit more time to do your exams.
Yep.
And it's centralised, so you all get employed through Charlie's, and you go to public and private labs all around Perth. There's nothing in the rural locations at this point. The applications come in around June, and you put it up on they're put up on the Jobs WA website.
Yep.
So to get into training currently, you need to have done 2 years postgraduate, though more years postgraduate often helps you in training. It helps if you've done an observership, because, well, you don't ever get a rotation in pathology. You don't ever know what we actually do, and you want to know what you're going to get into.
Yeah.
That's 1 or 2 weeks where you either work at Sir Charles Gairdner or at Fiona Stanley. You just watch and see what the others, the registrars do. And then you can do the BPS, which is the basic pathological science exam. And some years it can be quite competitive, so doing the exam may be what you need to get in, but in other years it isn't always needed. They take between 1 and 5 people a year.
Some great insight. Thanks for sharing that. You were mentioning, Dr. Ireland, that it's an area that you might not come across a lot during your medical school or junior doctor years. So I guess from your experience, what are a few things that you've really enjoyed about your training or working in pathology?
Okay, so this is not just from me. This is from 6 or 7 other registrars all at Charlie's, because heck, I'm only one person. But they really like that there's no on call. And you get public holidays, and you work Saturdays sometimes, but a lot of the time you get your weekends. You don't have to go into rural rotations, so you always get to stay in Perth, so you can be quite reliably in Perth. But one thing I really liked is the teaching focus. There are lots of tutorials for our exams, and there's a lot of teaching focus in our public hospitals and even in the private hospitals. So you learn a lot in WA, and it's known across Australia as being a good place to train.
That's excellent. Very lucky here in WA, yeah. And Dr. Ireland, what are some of the things that you've found through your training that were maybe the more kind of challenging aspects?
Yeah, so starting pathology, it's like you started again. What you learnt in med school doesn't really cut it. And you get pathologists who've been out for 30 years who still are learning new things and still feel dumb all the time. So that's not so fun. But it's also very interesting, and it's quite cutting edge. So if you like being curious, it's a good thing. The fact that we don't really have a curriculum for our exams, and what they base the knowledge on is the WHO textbooks, which they get updated every 5 years, and they change quite a lot, and usually double in thickness. It makes it quite a lot to study for. So that's not so good. But then one of the guys, he said he doesn't like opening bowels. That's one of the things that we have to do at work, is we have to do quite a lot of processing specimens, which we call cut up. And that's quite smelly and is quite repetitive. And if you were to do an observership, recommend that you make sure that you go there and you see what you'll be doing for the next 5 years, because it's kind of important.
Yeah, gotta have a strong nose.
Yeah, well, a lot of people, when they're doctors, you have to develop that anyway, the smell of melina and all, you know.
Yeah, it's very insightful. It sounds like, you know, it is quite a steep learning curve, but rewarding from your experience.
Yeah, for the first few years you feel quite underneath the learning curve, but then as you get towards your final exams, you start knowing more than the consultants that you work with, because they haven't done all the subspecialties, they've only done their own subspecialty, so it's actually quite good.
Yeah, very cool. They've got some questions coming through on the Q&A, and just a common theme that's coming up is how do you apply for maybe that observership you mentioned before, and what's it like is it easy to get that type of position?
The observerships are quite easy. I think we've been having somebody every week or two recently. So I think you would call our Director of Training, who is Yancy Wilson, and she works at Charlie's or King Edward, and her email is yancy.wilson@health.wa.gov.au, and she'll try and organise that for you.
Perfect. Yeah, it sounds like a great opportunity to kind of see the day-to-day work. Yeah.
Yeah, because otherwise you have no idea what you're getting into.
And if you had to describe your day-to-day, how does your typical day look like?
Okay, so mine's a registrar day or my day?
Let's say your day.
My day?
Yeah.
Okay.
And maybe as a registrar day as well.
Okay, so I'm a fellow, but I'm a consultant. So I sign out my own cases. I show cases to the other dermatopathologists to get their opinions. Plus I prepare for meetings. I do 2 meetings a week with the dermatologist, so I prepare cases for that. Plus I do some research on the side. I'm doing a post-fellowship diploma, so I'm constantly ticking boxes and doing assignments and filling in those kinds of things. So it starts at about 7:30 and for me finishes at about 5, but then at 7:30 in the morning on Thursdays we have a teaching meeting that we present at as well, which is quite fun. And then on Thursday mornings I go to dermatology clinic and see what I'm seeing on the microscope in action, which is pretty cool.
It's very cool.
As a registrar, you do 2 to 3 days of cut-up a week usually, and then on the other days you do reporting. Depending on where you are, you will report the cases that you cut, so that when you cut it you see what the pathology is going to look like at the gross aspect of it, and then you get to see it under the microscope, and that's really great when you get to see what it looks with the naked eye and then what it looks under the microscope, and you get to choose the bits that you're going to look at. And then depending on whether you're doing exams or not, you have tutorials usually on Wednesday evenings, then on Sunday mornings, and then scattered throughout the weekdays depending on what's available and what site you're at.
Well, thanks for sharing that. We just had one on the Q&A up there. It's, can you do dual training with pathology?
So pathology is a very big college. So it's not just anatomical pathology, but is other pathologies as well. So hematology is dual trained, endocrinology is dual trained, infectious diseases is dual trained. I think there's quite a few others, but that's not my specialty and I don't know much about it.
No, that's all right, yeah. So a few different fields that you can go into and potentially a few specialties which overlap with pathology.
Yes,
Great.
But I'm not officially dual trained, no.
Okay. And one up there as well is what PGY most people when they're starting training as a ballpark kind of?
So probably 3 to 4. I was quite a lot older because of other reasons. I spent a few years as a surgical registrar, but most of them are a lot younger. When I started, you could get in straight out of internship. So we had people 10 years younger than me. So
it's going to be a bit of variation.
It's quite a lot of variation.
Great. And as I guess we're coming to the tail end of our panel, it's gone very quickly. You mentioned before the BPS exam in your as something that's quite important for training. What would you say to kind of the medical students or even very early career doctors in terms of preparing for that, and when's a good time to sit it?
Whenever you feel that you want to do pathology training, sit it. Some of them, they'll do it in their first year of pathology training, and some people will do it in medical school. Right. Which you have more time in medical school, so why not? If you know that you want to do pathology, then do it then.
Right. That's very cool. So there are options.
Yeah, it's the first 10 chapters of Robbins. If you're already doing that in medical school, why not do it for the BPS if you know that's what you want to do?
Perfect. Thank you so much for joining us tonight, Dr. Ireland, and it's a lot of helpful information you've given. I'm sure all our viewers really appreciate your insight into the pathology profession, so thanks for joining us.
Thank you for having me.
Hello again. My name is Dr. Yasmin Solomon and I'm from the WA Country Health Service. Tonight I am your host for the Occupational and Environmental Medicine panel. A reminder to you all at home, you can ask your questions at any point via the Q&A icon on your screen. Now, joining us tonight from RACP's Australasian Faculty of Occupational and Environmental Medicine is Dr. Joel Silbert, Occupational Physician and Managing Director with OSH Group, and Dr. Russell Fayers, Occupation Physician Registrar. To start off our panel, I'll pass over to you guys so you can give us a little bit of information about yourselves.
Thank you, Yasmin. I'm Joel Silbert. I'm a consultant occupational physician, and I'm a failed cardiothoracics trainee from many years ago, and I resigned from Royal Perth Hospital at that time and looking for a different way of enjoying my life and enjoying medicine. I joined the faculty and I'm now 20 years or thereabouts as a consultant occupational physician, and I founded and own and operate a business in Perth that delivers occupational medical services, and we deliver services and enjoy dealing with a large number of organisations. We deal with corporates and we deal with insurance companies, and we deal with lawyers and the courts and other jurisdictions, and we practice the effects of health on work and work on health. Russell.
Okay, my name is Dr. Russell Fayers. I'm what we call a Stage B occupational registrar. I've been in the training program for about 2 years. Before that I was a general practitioner for approximately 2 years, and spent many years in the public hospital prior to that. And it was with my overwhelming interest in work cover and workers' compensation that led me into the occupational environmental training program.
Thank you both. I think a lot of our listeners at home won't really know a lot about occupational medicine and the training program. So Russell, do you mind telling us a little bit about what the training program is like, how long it is, what it entails, and how you get on? Sure. So essentially it's meant to be around about 4 years of training. It's split up into 3 stages, A, B and C. The first stage is generally around 12 to 18 months, and there's a stage A examination, which is similar to the basic physician's exams, the Part 1 exam. On successful completion of that exam, you then enter into your stage B. This is also a secondary entry point if you've got a fellowship from the College of General Practitioners.
At that point in your stage B training, you progress. It's more of a stage which lasts about 18 months to 2 years, where you develop your skills and understanding of occupational environmental medicine, but also you have that time to do what we call, you're expected to do a postgraduate diploma in occupational environmental medicine. And this can be done through Curtin University, Monash University, various sources, and that takes about 2 years to do part-time. Upon completion of that and the day-to-day training that you go through, you then aim to sit your exams, which is a quasi-fellowship exam in its own right, and also the clinical examination. And at that point, you then move into what's called Stage C, where you're really honing your skills as a consultant, polishing your work in terms of medical legal writing, general assessments, the working with clients in terms of their sites and the hazards and risks, and working with the clients' workers overall, but also working with the clients themselves.
Thank you. And once you have completed the training program, what are, I guess, the options like for being a consultant? Where are the kind of places that you can work?
I'll hand that one to Joel.
Thank you. Well, occupational environmental medicine training is in private. So there's very few positions in the public system that enables you to be able to complete training. So training is in private, and that then leads to the vast majority of physicians working in the private sector. So you may be the consultant occupational physician to a large mining company, or an oil and gas company, or an airline, or a government utility such as the public transport authority, so the rail system. Or the majority of occupational physicians are actually operating in private. So we may be doing pre-employment medicals and injury management, so looking at the beginning of someone's work life, the beginning of someone's life as an employee, maybe dealing with more independent matters, so as a consultant occupational physician, dealing with matters in terms of health problems that may arise in employees through their journey as an employee of an organisation. And these are common medical conditions such as ischemic heart disease or diabetes or asthma, epilepsy, major injuries coming from non-work related matters or work related matters as well. And then a group of us will deal with corporate matters, and then there's another group again that will become more honed on medico-legal matters and become expert witnesses in the court system and provide independent medical assessments on people relating to various matters that may arise, whether it's work-related injuries or motor vehicle accidents or litigious matters or total and permanent disability and those sorts of things. Finally, there's those occupational physicians that deal with a raft of other areas that are less commonly dealt with. That includes things like health surveillance, dealing with outbreaks. So COVID is a very, very good example right now, obviously. And we have people that deal with opening and closing businesses, and how do you actually close a business and then reopen it in light of the COVID environment that we deal with. Or outbreaks that we've dealt with before, such as scarlet fever, and an outbreak in a workplace, and how do we deal with that to make sure that we don't allow that to spread. So there's a vast array of different services that we provide as an occupational physician, and really the world is your oyster.
Definitely, it sounds like there are quite a lot of options.
No day is the same. Every day is absolutely different.
Thank you, Joel. We're getting a few questions from the audience, so let's look at this one. How would you suggest that somebody get exposure to occupational medicine, as a medical student or as a junior doctor, just to see, if they like it?
Okay, well,
from your experience?
In the public hospital system, you do have areas like the infectious disease health department, health areas, which you can become involved with, looking at vaccination, disease management within the hospital. Within WA, there are 2 hospitals that actually have an on-site occupational physician who run clinics, and if you approach them, they'll be more than likely happy to allow you to come into those clinics and get a good understanding of what they do in terms from the work cover, injury management, fitness for works for employees within the hospital system, and also how they manage hazards within the hospital system. One example being at a public hospital a few years ago where there was a gas leak within the air conditioning system, and when they actually identified what the issue was, it was based on management of where they put the gas canisters to the air conditioning system and how that caused and this effects on the staff and the patients throughout the hospital. And it was the occupational physician who was involved with this. So being involved or making yourself known to the occupational physician in the hospital is one way to do it. Secondly, you can approach the occupational physicians in the private practices and see if you can approach for work experience or get a role as what we guess an unaccredited registrar with a private practice to gather experience that way.
Or alternatively, contact the faculty. And there's a director of training in every state, yes. And the director of training will be more than happy to help you.
Perfect, thank you. Another question that's come up is, Russell, you mentioned that you came from general practice.
Yes.
So do you need to have a previous college qualification to get onto occupational medicine?
If you're taking the Stage B entry route via general practice, you have to be a fellow of the College of General Practitioners and have passed all the exams from that college to be accepted.
Okay.
But otherwise, no.
Yeah.
But you must start at Stage A.
Yeah.
Okay.
Yes. Yeah.
And what postgraduate year do you need to be to apply?
We would recommend that you have spent some time in the hospital system getting a good, broad understanding of all the surgical and medical specialties. Generally, that would be in a year or two into your unaccredited registrar years, so probably around PG4, PGY5, at least at a minimum, just so you've got a good breadth and understanding of what can walk through the door. Because on a daily basis, what walks through my door can be anything from a back injury to an eye injury to skin changes. It varies immensely, so you've got to be able to be comfortable dealing with everything that comes through.
Perfect. And we've just got a tiny bit of time left, so I thought we'd just leave with one final question, which is, what is the work-life balance like?
Thank you, Yasmin. All I can say in closing is that it is 9 to 5 Monday to Friday. There is no blood, there is no smells, there's no body fluids. It allows us to deal with the best parts of all of the disciplines in medicine. We don't deal with any of the nasty bits or the difficult bits that we found so difficult at university and junior days in the hospital system. And it works well. There's something new and something different every single day.
Great. Thank you both so much for being here tonight, and that's all we've got time for. To everyone at home, please don't forget to submit your feedback, and thank you so much.
Thank you.